Good morning, students. My name is Demi,
And my name is Grace.
and today we will be discussing the three main documents endorsed by the Nursing and Midwifery Board of Australia. These documents are a fundamental component of our role as midwives, and it is imperative that you familiarise yourself with these documents over the next 3 years. This presentation looks at what these documents are, why they are so important, and the way in which they shape the role of the midwife. The word midwife means with woman. This translation lies at the core of the philosophy behind overall midwifery practice and interactions with women. A midwife, as defined by the International Confederations of Midwives, is a woman-centered political primary healthcare professional that is responsible and accountable for working collaboratively with women during pregnancy, childbirth, and the postpartum period. They focus on the individual needs of each woman in order to give necessary support, education, and care to both the woman and her infant. In order to provide holistic midwifery care, it is imperative that the care provided address the social, emotional, physical, and cultural facets of maternal health as identified by the woman herself. The Code of Ethics is a code developed by the Nursing and Midwifery Board of Australia as a framework by which Australian midwives should shape their ethical practice. It is a document that should be adhered to by all midwives within Australia and within all areas of maternity and neonatal services. This code should assist you in developing your knowledge and understanding of ethical midwifery practice and provide guidance in responding effectively to issues that may arise in your daily practice. Ultimately, this code aims to outline certain values, behaviours, and morals that should be used to guide the ethical behaviours and practices of all midwives Australia-wide. The foundation of midwifery is centred around the respect and value of childbearing women and understands the impact this has on society as a whole. It is a woman-centred practice that revolves around the trusting relationship between woman and midwife. In understanding this, the Code of Ethics places value on the respectful, empowering, understanding, and accepting nature of the woman-midwife relationship, ensuring we provide culturally competent care. It highlights the importance of access to equitable education and safe services as a means of empowering women to actively participate in their care. It also outlines the importance of privacy and correct documentation and amplifies the long-term positive effect that our profession has on societal outcomes. It is our role as midwives to follow the Code of Ethics at all times within our daily practice. We should use the code as a means of shaping our ethical behaviours and guide our interactions with women, families, and colleagues. It is imperative that you refer to the Code of Ethics regularly throughout your practice, and especially when presented with situations that challenge your moral code. Examples of this include maintaining the privacy and confidentiality of the woman within your care, and ensuring practice is respectful and safe at all times. Similarly, practice should respect and promote the individual maternal, cultural, and societal expectations and provide specific care that is sensitive to these. Morality is often closely linked with legality, and it is therefore essential that documentation be accurate, concise, and contemporaneous, and that you are able to acknowledge when something is out of your scope of practice and refer appropriately. The NMBA competency standards for the midwife follow on directly from the Code of Ethics and have strong identifiable links. The difference, however, is where the Code of Ethics outlines the framework for correct ethical behaviour in the workplace, the competency standards incorporate these behaviours into 4 guidance domains of competent midwifery practice. The national competency standards are the primary standards by which your midwifery practice should be guided, and ultimately will be assessed. Meeting these standards is essential in order to obtain and retain a midwifery registration within Australia. The competency standards are not only designed for midwives, but can be used for women, families, and universities. The women and families within your care can use the competencies to ascertain what they can expect from their midwives, and the universities can use them as a guide for curricular development and student goals and assessments.
To break down the competencies a little further, you will notice that there are multiple elements under each. These elements provide specific examples explaining how we as midwives successfully fulfill our competencies. If you project your attention to this slide, you will notice an element is provided for each domain. Legal and professional practice refers to the knowledge we have regarding the Australian healthcare system and legislation, as well as our compliance with common law. Thorough and appropriate documentation of clinical care and compliance with hospital policies and guidelines is just one example of the ways in which we as midwives already integrate the legal and professional competency standards within our practice. Midwifery knowledge and practice refers to the importance placed on the midwife-woman relationship, respecting, educating, valuing, and supporting women. This could be through continuity of care, antenatal, intrapartum, and postnatal education, or even appropriately responding to emergency and complex situations. Midwifery as primary health care refers to woman-centered care with a commitment to midwifery as a public preventative health strategy. This may be through advocating for and protecting the rights of women or practicing culturally safe care. Reflective and ethical practice involves practicing in accordance with both the Code of Ethics and the Professional Code of Conduct, which we will discuss a little later. Midwives must respect diverse values, beliefs, and socio-cultural structures, ensuring they provide culturally appropriate care at all times. It is also important in regards to ethical self-growth that we as midwives continually reflect on individual practice through self-assessment of individual work and education, ensuring our practice is evidence-based. The Code of Professional Conduct is very well supported by the Code of Ethics and the competency standards we've just discussed. In fact, these three documents provide the framework for the ways in which we as midwives must be accountable and responsible for our practice. Professional conduct refers to the ways in which individuals behave in a professional capacity, and so the Code of Professional Conduct contains a series of 10 statements that provide a minimum standard of conduct for midwives in a professional setting. It is essential to understand that these codes are in place for the safety of ourselves and the women and families in our care. They provide uniformity and order within our practice on a personal professional level. Each of these documents can be accessed on the NMBA website. You can thoroughly read through each document with the additional information we've discussed today. On the Code of Professional Conduct document, you will notice the 10 statements, each thoroughly expanded on. On this slide, a brief summary of each statement is listed to gauge an understanding for what the codes entail. It is important to notice the correlation between each of the three documents, as we notice many similarities between them. They further complement one another with specific emphasis on safe, compliant, and legal practice, woman-centered care, informed decisions, making and respecting of women, families, and colleagues. How we incorporate this into our practice is discussed in the explanations of each of the Code of Conducts at the end of the document. For example, Conduct Statement 6 states that midwives must provide impartial, honest, and accurate information in relation to midwifery care and healthcare products. Though this explains what the conduct is, the explanation explains how we can implement this. The explanation states that midwives provide advice about care or products through a thorough explanation, including the advantages and disadvantages, allowing for informed decision-making. Midwives also ensure their advice is based on adequate knowledge and not on commercial or other forms of gain, and thus refrain from the endorsement of services or products. With each code of ethic, the explanations that are given provide the foundation for which we as midwives and midwifery students should appropriately practice. The ways in which we can integrate this into our practice can be further summarized in examples such as these. Midwives should not accept products from any companies so to avoid endorsing any products that may not be evidence-based. For example, promotional products from formula companies. Midwives are required to continue their midwifery education each year through 20 additional hours known as CPD points. This ensures that midwives are constantly updating their knowledge and education and practicing with the most current research. These codes are integrated within our practice, as they allow us to fulfill our Code of Ethics, competency standards, codes of professional conduct in a way that is conducive to ourselves and the women and babies in our care. The skills and knowledge we acquire as students and midwives purposefully allow us to unintentionally practice the codes and competencies of these documents. However, with intention, we are mindfully able to practice and incorporate these codes and competencies into our practice more effectively and efficiently.